I think in my practice more than anything else, people will come to me because they don't want to take medicine for a problem. They want to, if there's any other option, can I do anything else? Then I'll say, well, yeah, eat differently. And frequently people will and they do well. Sometimes that doesn't work. If they eat well, they generally will lose weight. So losing weight, sure, sometimes that works. Then they want, instead of a drug, they want to have a natural supplement, a treatment that will work. Well, there are some things for blood pressure that do work. They do help, and there's good documented evidence. Well, one of the things is when you eat fish, especially white fish, has a protein in it that seems to drop your blood pressure. Of course, you don't want a lot of salt on that fish, right? You just want to have that fish with maybe just a little sprinkling of salt, but you can put a lot of garlic on it because garlic drops your blood pressure. So think about some grilled fish, a little bit of garlic, or a lot of garlic, easy on the salt. That's a great way to start. Then, of course, and this is my favorite, anybody who's under stress has the tendency to have a higher blood pressure. Anybody who's under stress tends to leak magnesium. So if you're leaking magnesium and you're under stress, well, work on your stress, do some stress reduction, and maybe take some magnesium. Foods that are rich in magnesium are excellent. But let's be honest, you're not going to eat 8 to 10 servings of vegetables a day probably, right? So instead, you can look at magnesium supplementation with a natural form, magnesium malate or glycinate, or one that's easily absorbed by your body, and that will relax your smooth muscles in your arterial bed, and frequently you can see a reduction in your blood pressure. Other minerals that work are calcium and potassium. Almost every doctor who you will talk to will have some understanding of this and some knowledge about it. So always check with your doctor and think about, in addition to all the other lifestyle factors, a little magnesium, a little calcium, a little bit of potassium, and maybe some grilled fish, heavy on the garlic, easy on the salt. Talk with your doctor, we're better together.